Hi, I'm Gelderman. Thank you for joining me today and welcome to this online training video. Today's video is the second of a 5-part series on increasing your recall, revisits and reminders. This video today focuses specifically on how to consistently get your clients to come back for required care on their pet by pre-booking, by booking in advance. Once again, I'm Gelderman. I am a veterinarian and I owned my own practice from 1977 to 2009 when I sold it to turn to full-time coaching, consulting and speaking. I'm the author of 4 published books and I've recently contributed 4 chapters to the October 2013 published 5-minute veterinary practice management consult. I speak at events and trainings and seminars all over the world. 2 of the websites I have are Turbocharge Your Practice and Veterinary Classrooms. So let me ask you this theoretical, quick and simple question. When you received that phone call from the practice down the road asking you to refer Mrs. Smith and Josie's records, were you maybe a little bit miffed? Because look, she was supposed to come back. After all, you did tell her to, didn't you? Look, I know that might not happen to you personally. However, sure as eggs, it's happened to veterinarians that you know, even perhaps veterinarians within your own practice. How would you like to learn the specific steps and strategies that will allow you to book in the patients that need to come back for medically appropriate, revisits, and to do so easily and consistently? And to have your clients absolutely loving you and raving to their friends about the care and attention that you gave them. So, as I said, your clients will love you for it because your average client is the married working mum who's trying to juggle family life, work, career, all those sorts of things. She's trying to look after everything. So this strategy fits right into what these mums are used to, with their hairdressers pre-booking the next appointment, their dentists doing the same thing, their healthcare professionals, their gym teachers, etc., all organising life along that road to make it easier for them. Before we move on, quickly look at the results from some people. There's a practice, one of my Inner Circle one-on-one clients in Sydney, that within 3 months of starting this strategy had to put on an extra veterinarian, an extra nurse and an extra receptionist because they were so much more busy. I've had exactly the same feedback from a practice in Cape Town and a practice in LA. So I can give you a lot more examples than that. This strategy works in mixed practice, in large animal practice, in small animal practice. The results are typically excellent. So let's get started. Let me ask you this question. What percentage of pets that you see for primary disease do you think should come back for 1 or more revisits? Do you actually know whether the study's been conducted into those numbers? The short answer is yes. There have been studies focusing on 2 different aspects of that question, of that revisit. Number one, from a good medicine perspective, out of every 100 sickness or illness cases, what is a medically appropriate revisitation rate? And secondly, from a practice financial success perspective, is there a correlation between revisit rates of illness cases and practice profitability? Let me just quickly explain some of these independent studies. From a medical perspective, interviews, studies and research indicates from a gold standard of medicine that just over 30% of all illness cases should revisit to see you. And then from a practice profitability perspective, there's a significant correlation between higher than average practice profitability and pet revisit rates. In other words, practices that typically had higher revisit rates also had higher profitability. Now, the revisit rate was about 32%. About that area created maximum profitability. Isn't that interesting? From both the good medicine perspective and the practice profitability perspective, that the pet revisit rates are about the same. Now, let me ask you this. What do you think your pet revisit rates are in your practice? All you need to do is pick 100 illness cases, not wellness cases, illness cases, discard all your wellness cases, and count the percentage of those pets that actually come back within a reasonable period of time, say 4 to 6 weeks. Now, many of the new veterinary software programs will actually auto-calculate that for you, very simple. So I'd suggest that you track and measure that number as soon as possible, because in most practices that I know, it runs as low as 13 to 18%. Wow. And as you know now, it should be up around 30%. What an opportunity for improved patient care, improved client care, and obviously improved practice outcomes. What started this all for me in my practice many years ago was that I actually had clients not come back because they forgot, or they were too busy, or because they were told to make that decision. You know, and you know, they didn't have the skills, the medical skills to decide whether that problem was resolved or not. Life got in the road and they forgot to come back. All sorts of reasons they didn't come back. As I said, that was many years ago, and I would definitely not put them in such an unenviable position these days. So one day it hit home for me. Patients were missing out on care. The client didn't have the medical qualifications to make the decision with respect to whether they should come back or not. So let's dig deeper and examine some of the basics here. Clients do not have the skills, training to make those medical decisions. And what's more, all the latest studies, and if you don't know them, go and look at the Brachy study as an example, they don't want to make the decision. They want us to make the decision for them and control the situation, keeping them informed and having some feedback from them as well, okay? We're the professionals, we have the training and the skills. Ultimately, clients just want peace of mind. Your typical client is a married mum with kids who's trying to juggle her career, her family, her children. She's juggling far too many balls in the air all at once, and she's just saying, please just make life easier for me. So here it is, your 5-step pre-booking blueprint system. Step 1, get all your vets in the practice together into a meeting. Get an A4 sheet of paper, draw a line down the middle. On the left-hand side, write down all the diseases, problems, challenges, everything that a pet needs to come back for, from a Schirmer tear test to anything up to 3 months. On the right-hand side of the piece of paper, write down the revisit time, whether it's 24 hours or 7 days or 3 weeks or whatever. So do this for 3 months. Get really tough on the time frames, nut them down. So get that piece of paper laminated and go to step 2, which is training the team as to the diseases or the problems, when the patient needs to come back and why. And then the team can role play. This is typically a receptionist and your nurses can role play and rehearse any pushbacks or objections that the client might have about why they can't make that appointment. Typically you'll hear things like, I don't have my diary with me, I don't have my roster, or I don't know my roster, what if my roster changes, I'll forget the appointment, things along those lines. Step 3 is to train everyone to use the word need. Your pet needs to come back, not could or should, or it'd be great to, need. And then step 4 is for the veterinarians during the consultation to tell the client very specifically, Fluffy needs to come back in 7 days or 21 days or 48 hours or whatever it happens to be. And then the veterinarian will either make that appointment in that consultation or take the client out to reception, which is step 5, where your receptionist acts as a safety net and makes that appointment. She's got that laminated list. She knows that the pet's come out with some Oturna, and on the invoice there is an ear swab. So she knows that pet needs to have an appointment to come back in a week and then again in 3 weeks, for example. So in 95% of cases, this 5-step system is going to systematise your revisit process, and it's going to flow smoothly. In about 5% of cases, a particular veterinarian may want to deviate from that protocol for whatever reason. In that case, he would either make that deviation in the consultation and book that client in, or walk out to reception and say, hey, look, we need to see the Fluffy in 10 days rather than in 7. So this is the exception to the rule. Now, what result should you expect from this system? Typically, as I said earlier, most practices have a revisit rate of about 12, 13, maybe 20% tops. Using this strategy, you'll typically get your revisit rate out of primary illness cases, primary disease cases, up to about as high as 30 or 35%. So if you don't get those sort of numbers happening, then I'm really going to suggest that you tighten up on that process, because it's a really achievable result. So in a future how-to online training, we're going to extend this video, or the thoughts of this video, to pre-booking sterilizations off the back of the annual health check visit, or the puppy kitten vaccination visit. And we're also going to talk about pre-booking annual health checks, wellness visits, whatever you want to call them, 12 months ahead. Yeah, that's correct. 12 months ahead. And the system we'll use, when you follow it, will have 85% of your clients showing up for that visit. So before we finish today, let me ask you quickly, before you get to that other video, to check on what's your current vaccination annual health check recall rate. Most practices are getting 40 to 50% tops. Using this system, you'll be able to get 85%. So that's something to really keep your eyes peeled out for and looking forward to. So finally, thanks so much for joining me today and watching this video. If you've enjoyed what we've shared, please leave your comments below, and also leave me some feedback as to what you'd like to see in future videos. Thanks so much. Bye.